ladies, I'm here to give you my final presentation. I'm doing mine on mirror therapy. I don't know if any of you have heard of mirror therapy. Obviously it's a newer approach to treatment that can be used. I had heard about it over the summer with the OT that I worked with. I didn't see it used in practice, but I did read an article about it and I found it to be very intriguing. And so I want to do some further research on it. So mirror therapy uses the visual input of the mirror to trick the brain into thinking that the damaged hand or limb, whatever you may be working with, is working normally. So I know by looking in this mirror that I'm looking at my left hand through the mirror, but my brain doesn't see it that way. The brain, when it's looking at the image in the mirror, it's seeing my right hand. So that's the part that we're tricking. That's the part that we're trying to help the patient with. So mirror therapy was first reported in the 1990s by a neurologist. I'm going to try with the name. It's kind of a hard name, but it's Vilayaner S. Ramachandran. Ramachandran, I did hear that in a video, so I'm pretty sure that's roughly how you say it. A lot of times you'll see V.S. Ramachandran. Anyways, he came about this idea in the 90s. I'm going to attach a link to TED Talks, compliments of Janine. She had kind of sent me in this direction, and he gives an outstanding speech about the brain. And he talks about 3 different aspects of the brain, and it kind of helps you understand the other 2 aspects if they kind of lead into each other. And one of them is about the mirror therapy. So again, I'll attach it in my handout, and you guys, it really is. I think it's like 26 minutes long, so it's fairly easy to watch and short. Some of the populations or conditions that you may use mirror therapy with is individuals who have had amputations and have phantom limb pain. That could be from a disease, that could be from an accident, an injury. Injured soldiers have. I watched a YouTube video about that, and that's kind of a common area that you'll see some of this used is individuals who have lost a limb during war and are now having the phantom limb pain. And actually, Ramachandran, the very first study he did was for phantom limb pain. And then more studies since have been done that also include the complex regional pain syndrome, or RSD. You have stroke. Particularly, they're looking at individuals who are suffering with the hemiparesis. One, to either just try to trick that the muscles into like moving again. Another is the pain that may be associated with the hemiparesis. More so the pain, but I did read a little bit about the movement, maybe being able to trick the brain into thinking that the limb's moving, and over time the limb will regain its function back, maybe more so than what it was originally gonna. Also, there is some of the people you can use this with are individuals who have had a hand or foot injury or surgery. They may be experiencing the pain, and also children with hemiplegia. I only saw one article in my research as I was looking around, but it makes sense. They use it for adults with hemiplegia. So, but the main 3 areas that are research that you will find research on are the amputations with the phantom limb pain, stroke rehabilitation, and complex regional pain syndrome. The cost for mirror therapy is relatively cheap, especially if you have a mirror at home. I got this from work. We use this with our patients. It's just a tabletop mirror that we can take in their rooms. I want to say they were like $12. I mean, it's plastic, cheap. Also, we have this one hanging in Corinne's bedroom, so it's like a long mirror that if you need to do more of like standing activities, so you're incorporating the legs, you can use a mirror like that. Some of your rehab clinics may have a bigger mirror on wheels that they use during therapy. We have a mirror in our gym. It's attached to the wall, but you can purchase them on wheels. Or there is a mirror box that can be bought. It's just like kind of made out of nylon, and it has like the plastic. I kind of think of it like a nylon hamper that you can like twist it and it collapses, or if you untwist it, it like pops open to its shape. There's two different ones. There's one made for the hand and wrist, and there's one made for the arm, foot, and ankle. The hand and wrist one is $29.99. Arm, foot, and ankle one is $74.99. And these are made by Relief Pain Management. Again, I'll have a link on the handout to their website. But the whole affected limb is enclosed inside of the mirror box. And then the unaffected limb's on the outside of the box with the mirror, so you can see it. So some of the treatment guidelines that are recommended, there's nothing really set in stone. Research actually is limited in this area, like I said. So, but a typical concept that I've grasped from my research is to use at least 30 minutes of mirror therapy a day. Ideally, it'd be recommended to do mirror therapy 3 times a day, if able, but ideally once a day for 30 minutes a day. The mirror is placed at the individual's sagittal line, so right down the middle, both if they're standing or sitting, regardless of where their position is. That way it's in the middle of their body, so the affected limb can be hidden behind. You guys can see it, ideally it would be hidden behind, and then the unaffected is in the front. You want to start off with a nice relaxed atmosphere for the person. This is just so they can kind of get comfortable with it, and you can kind of see where their limits may be. They may only be able to start with 5 minutes a day, which is fine. You obviously want to grade the activity. If they can tolerate more, have them do it longer. If they can only tolerate 5 or 10 minutes, only have them do 5 or 10 minutes. Also, there may be exercises that you're using with the unaffected limb that the affected one has not done in several months. And so you may not be able to start off, you may have to start off with some simple techniques. And I'll show you some here in just a moment. You also, if you're working with the arms, you're going to pull up the arm sleeves. If you're working with the legs, you're going to pull up the pant leg, take off shoe, sock, so everything's uncovered. Initially, when you first start it, you're going to keep the affected limb still. You're going to have the individual with the unaffected limb over here, and they're just doing some simple movements. You're going to have them turn their hand up and then back down. You're going to do like some wrist extension and flexion, finger opposition, just some basic hand movements. And then obviously they're going to look at it in the mirror as they're doing it. You may have them bear some weight through that hand just by pushing down. You can even have them bring the hand right up to the mirror. Get some tactile input in there. And then once you kind of do that for a little bit, no set time, just let them get comfortable with some movements, you're going to incorporate the affected hand. So simultaneously, both limbs are going to be doing the same movement. So I have my unaffected limb, I'm going to extend my wrists, and so as much as the affected limb can, I'll extend the wrist. Back down. My unaffected limb may get some good extension, and my affected limb may not, and that's fine. It's you focusing on doing those movements with the affected limb. So the brain's seeing all this extension in the wrist, or your hands making a fist, and even though this one might not be able to get a full fist, your brain is seeing it get that full fist. The concept is that then the pain and sensation that they're feeling that's uncomfortable in the hand that they can't move or the hand that's not there will eventually go away over time, because you're tricking the brain into thinking, oh yeah, it can do those movements. It's good. We can make a fist. I can itch the tip of my side of my finger that's been itching, because if it's a phantom limb, that finger's not there, but that itch sensation still is. So you don't only have to do this activity in a quiet area. That's just recommended initially. From there, you can move it anywhere. You can have the patient do it at work. You can have them do it at home. You can have them do it at the beach. You can have them do it while they're by themselves, while they're listening to music, while other people are around. You can have them do it at different times during the day. And you can have them do it even while they're in different emotions. They don't need to be all happy and perky. They can be grouchy and mad, So it's just because your body's doing those movements all day anyways, so incorporating them into the treatment's good as well. Some of the key points to remember are to always do simultaneous bilateral movements. Move both hands at a time, and if bad limb can't move, then concentrate on thinking about moving it. Really focus on moving that bad affected limb, even if it's not moving. You want to concentrate on doing the movements while you look at the virtual image of the hand in the mirror. Always look in the mirror when completing the exercises. And then you want to build up the repetitions and the frequency of these slowly and steadily. Like I said, someone might not be able to tolerate more than 5 minutes, and then just over time you progress them naturally, just like any other therapy that we may be providing. So for how is OT involved, OT can make it functional. It's kind of limited with the space you have with the mirror. Some of the things I thought of were washing the face if you were standing against a long mirror, having the patient bring the washcloth just up to the face or brush the teeth. This can also be used with other rehab treatments, or it can be used solo. For a half hour, you could use this with your patient. You can also have your patient do it as a home exercise program. But I think the most important part is making it functional. It's going to be kind of challenging to do. Another idea I had was the longer mirror that I had here. You could lay it out on the table, and you could have them reach for an object. I have a sponge up here, so you have them reach out for it and grab it and pull it back in, like wiping the tables. Something else I forgot to mention is you can actually incorporate some strengthening with your mirror therapy as well. Last but not least, the funding source, as far as insurance covering it, I did not find anything about that. Again, research is very limited. I'm guessing it's just like any other OT intervention that we may use, that you need to make it functional. You really need to show how this is going to benefit the patient and what function they're gaining out of it. If you guys have any questions, please don't hesitate to ask. I will have this posted up on the discussion board as well as with my handout. Hope you guys have a great evening.